Okay, yeah, this is Title II of the Department of Health and Human Services. And I guess this is where our health care is going to be coming from. So there is not going to be no Obamacare. There's not going to be no Trump care. It's going to be this right here. What we need to do, I didn't get a chance to, is to read up on that the Public Health Service Act. It's right here. Reference to in this act as the PHS Act. We need to find out where. Let me see. Where's that? It's up under. This is what they're proposing to spend on that, and it's up under section 224G to N and Q of the Public Health Service Act. I'm gonna pull that up later, but I wanted you all to see this. I guess the health workforce. This is about, I guess, the health insurance that your employers are providing to you, and what they were mandated to do. What they were mandated to do in terms of how health insurance is going to be covered. And then up under maternal and child health, we have to look up these codes. We have to look up these codes. And then especially this one right here for the American Jobs Creation Act of 2004. We need to find out what all this means. And then the Ryan White HIV AIDS program, the healthcare systems. We need to find out what it entails by reading titles 3 and through that title, and and find out what this entails, the systems that they're saying we're going to be involved with, and the rural health. I didn't read through this. The family planning, I read through this because they have a project plan. It's called Plan X, Title X. That Title X, and that Title X program pays for abortion. So this portion right here is a lie. I'm going to post that Title X up here because in here it's saying that the project will not be paying for abortions. That all pregnancies, counseling shall be non-directive, and that such amount shall not be expended for any activity, including the publication or distribution of literature that in any way tends to promote public support or opposition to any legislative proposal or candidate for public office. You see how they put that in there? See, this is why we have to pay attention. And mainly, you all need to read this. The Vaccine Injury Compensation Program Trust Fund. So apparently they're saying something about the vaccinations that we're getting that for claims associated with vaccine related injury or death. Oh my God. And then it's the Center for Disease Control and Prevention, the Emerging Zoonotic Infectious Diseases, the Chronic Diseases Prevention and Health Promotion. You all need to read this. This is the worst bill I ever seen in my life. I've never seen anything. National Cancer Institute. It was something in here talking about the way they, I think it was up under the Mine Act. No, it's not up under there. But it's something up under here. They're going to be cloning something. They're going to have they got a project already in effect where they have prisoners leaving the prisons to go out and, I guess, get pregnant so that they can inject them with some type of, I don't know what they're injecting them with, to see what type of disability that baby is going to be born with, and they're going to follow the baby for up to 5 years. It's back here somewhere. Is this it? It's in here up under the health. But the National Institute of Health, I'm not for certain how this is going to work, but it's something about telehealth. I don't know how that's going to work. Are they going to do this over the internet and all of that? I'm not for certain. But this is the H.R. 244 Consolidated Appropriations Act of 2017. This is the spending bill. This is the budget for 2017-2018. You all need to read this. You need to read this because this is very important. It's basically telling you everything they're getting ready to do to us, how they're going to spend our money, how they're going to take our money, and everything. So they're getting ready to spend a lot of money on this substance abuse. So it's something in one of these pilot projects that they're doing where they're going to get a lot of people addicted. I'm not for certain. I'm not going to sit up here and assume anything. And it's the Centers for Medicare and Medicaid Services. Oh my goodness. For carrying out except as otherwise provided by these titles right here, we need to look these up, of the Social Security Act. Look how much money is to remain available until expended for making after May 31st, 2017, payments to states under that title, or in the case of Section 1928, on behalf of states up under this title of the Social Security Act for the last quarter of fiscal year 2017 for unanticipated costs incurred for the current fiscal year, such sums as may be necessary. Wow. Look at this. For making payments to states, or in case of Section 1928, on behalf of states under the title of the Social Security Act for the first quarter of the fiscal year 2018, this amount of money is to remain available until expended. Payments to healthcare trust funds, program management. So we need to find out what that PHS Act is, because that PHS Act is where a lot of people are going to get their health insurance from, and how much money they're going to charge us for that. Administration for Children and Families, Low Income Home Energy Assistance, training and monitoring of program activities for compliance with internal controls, policies, and procedures, and may, in addition to the authorities provided in this we need to read this section up. Use such funds through contract with private entities that do not qualify as nonprofit agencies. We need to find out about this. Anybody that's low income, you need to find out about this. Let me get to the military portion, and that's going to be last so that I can post this up for you all.